Hello, and welcome to another episode of This Week in Hearing. I'm Brian Taylor, and my guest today is Dr. Meredith Holcomb, who's an associate professor of clinical otolaryngology and the director of the Hearing Implant Program at the University of Miami Ear Institute. And today we're tackling the topic of undertreatment of hearing loss in adults. Dr. Holcomb, I want to welcome you to This Week in Hearing. It's great to have you with us.
Thank you for inviting me. This is exciting.
That's for sure. This is a really important topic, I think, and one that kind of flies under the radar. And before we get into it, Meredith, I thought if you could share a little bit about yourself, where you practice, your role at the Miami Ear Institute, that would be great.
Great. So as you mentioned, I'm an audiologist. I've been providing cochlear implant care specifically in audiology for 16 years. I trained at the University of North Carolina in Chapel Hill, and I'm the Hearing Implant Program Director here at the University of Miami. I'm very passionate about improving access for patients who need hearing loss treatment. And, that's sort of how some of these initiatives we'll talk about today. That's kind of how I got involved with it. One of my big passions is making sure that communication is available for as many patients as possible, however that is, whether it's captioning for our appointments, which we do that here, or just making sure that we are providing the best care possible for all of our hearing loss patients.
Very nice. I guess my first question is, from your perspective, as a cochlear implant expert, just how big of a problem is the undertreatment of hearing loss in the adult population?
Yeah, I think we've got an enormous problem. And honestly, Brian, it's a big enough problem that in 2021, the World Health Organization, sort of used hearing and untreated hearing loss as part of their initiative. We have millions and millions of people in the US and in other countries who are experiencing hearing loss, and that those numbers are expected to grow exponentially. By 2050, what is expected is that there's going to be about 711 million people who have a disabling form of hearing loss, and disabling means it's impacting their life in some way. I think when you think about hearing loss, it's an invisible problem for a lot of people. We can't see it. When I had knee surgery, I remember several years ago, you could see the brace. People got out of my way or said, "Can I hold the door? Help me do things." With hearing loss, it's not something that's easily visible. And so we oftentimes don't know that our colleagues or our friends or our family members are suffering from this. Treating it, the reason it's really so important and why it's such a big problem is that hearing loss can affect so many other parts of our health, cardiac concerns, mental health concerns, cognition concerns. All of those things have been linked. Diabetes has been linked to hearing loss. There's sort of a kind of a story of how that all works together, but it's an enormous problem. And communication is one of the main ways that, we are able to live our life with our family members and our loved ones. We saw that during the height of COVID. Not being able to communicate really was destructive on a lot of levels for people. And so making sure that we can provide care for patients who need hearing loss it's a huge concern. And the biggest problem is that the vast majority of patients who suffer from disabling hearing loss are not getting in the door and are not being treated.
Well, and that's, I want to get into that a little bit more and with more detail. I know that you were involved in some recently published guidelines around referrals for cochlear implants. So yeah. I was hoping you could tell us a little bit about more about these guidelines for adults and cochlear implant candidacy.
No, great. It's been a 2-year journey of 50 global task force members. And when I say global, I mean we on the map of the globe are representing so many of the areas that need to have a voice in this topic. And these people have come together. We've looked at the evidence, the peer-reviewed information, what our researchers are putting out there. We've looked at what is lacking, what's necessary. And what we've really found is there's a huge need for us to better identify and standardize the care that patients are receiving even before they get to the cochlear implant process. So it's getting the patients in the door of a clinic, getting patients identified with a hearing loss, and then, of course, being treated appropriately with a cochlear implant when they need it. So all of those steps are highlighted in these living practice guidelines. What's really cool about the guidelines is because they're living, they can change as the research changes and as the needs change. But if you can imagine getting 50 task members to vote and agree on guidelines, it wasn't the easiest task that we all undertook, of course. But I think what came out of this is a really lovely document that providers, family members, and even patients can look at to help navigate this very complex process of getting the right treatment for your hearing loss.
Right. And I'm not expecting you to have the website where you can find those guidelines memorized. But if you have it off the top of your head, could you share that with us?
I do not have it on the top of my head, but I can certainly look it up, and I can get that information as through either in this session, or I can send it, Brian, to you, and you can make sure that you have it.
That's all right. What we'll do is we'll put those guidelines are posted in the show notes, and people will be able to click on the link to the guidelines that you just talked about. So that's good to know. As a clinician myself, based on my own experience, I know that there are a lot of adults out there with severe hearing loss who really struggle with traditional hearing aids. And it seems like there's maybe a bit of reluctance, or maybe it's just a lack of information that kind of gets in the way of clinicians referring those patients for cochlear implants. So could you tell us a little bit more about some of the guidelines around who might be a cochlear implant candidate for an adult hearing aid wearer? What would be an indication that they should maybe go and seek a more formal cochlear implant evaluation?
It's a great question. I think the top sort of, I guess maybe the number one thing that patients should think about is if they are wearing hearing aids and those hearing aids are not providing them with enough audibility or enough opportunity for them to hear and communicate well with their loved ones, that's a huge red flag and something that they should certainly investigate a little further. And I would say that those patients a lot of times are the patients who need to be seen for a cochlear implant evaluation. Now, from a provider perspective, we have some cool sort of metrics that we look at to try to identify patients who are potential cochlear implant candidates. But from the patient perspective, really the number one thing is if the patient or their loved ones have concerns about how they're performing with their hearing aids, it's probably time for them to take the next step and get just a little higher level evaluation. That's pretty simple to do. It's just not done in all audiology offices. So I think sometimes patients don't know where to go, which is part of what these living practice guidelines are hoping to address. But there's great information on the web for cochlear implant manufacturers, also for an organization in America called the American Cochlear Implant Alliance. There are maps on specific centers that are in your area that may be able to offer those evaluations. So it's out there. We just need to make sure patients know how to navigate all of those, I guess, media outlets in order to find the right place.
Right. And we'll put some of those links to the websites that you mentioned in the show notes so people can find them. You already kind of alluded to it a little bit, but could you give us a little bit more information for any consumers out there that have severe, profound hearing loss that might be struggling with their hearing aids? What's some good advice that you might be able to share with them?
Yeah. The one thing that I tell patients is you have to be your own best advocate. And oftentimes we hear from many patients who come in the door here at University of Miami, I've been getting new hearing aids every 5 years. My hearing has still been severe to profound, or I've been struggling with every new hearing aid that I've been fit with. I finally found a way to get into the evaluation. And so, no disrespect at all to any of us hearing healthcare providers, but we as audiologists really don't do the best job of sort of nudging patients to go look for a little bit more information for their hearing loss. But I think the best thing patients can do is ask questions. If they're unhappy with how they're hearing with their hearing aids, ask if there's something else that is available for them. What we really want to see with these guidelines as well is that there's a hearing health continuum. I think up until recent years, there's sort of been, you have a little bit of hearing loss and then you have a lot. If you have a lot, then you do hearing aids. And then maybe if hearing aids don't work, the last resort is a cochlear implant. And the topic of conversation around cochlear implants is unfortunately almost been a little bit negative. Like if you end up with an implant, you're almost failing with your hearing, right? But what we know is that candidacy is changing so much. We see patients now who, they can still score around 60% or less on some of their speech tests that we do for their hearing assessment. Those patients are implant candidates. Back when I first started, you had to have like 0% understanding. And now really implants are able to help patients who hear, 50% with their hearing aids. So there's always more information and more education for patients, but they've got to be their best advocate and really ask the right questions too.
Yeah, you brought up a couple of really great points that I wanted to kind of go back and talk a little bit about. One
Sure.
is you mentioned the 60% criteria. Could you tell us a little bit about that 60 by 60 criteria? I know that's kind of a new thing, and some of our hearing care providers may not even know about that yet.
Yeah, so the 60/60 was created, I guess, or discovered rather, by Dr. Zwolin and her colleagues at the University of Michigan. She's a really good friend of mine, and I remember when she was working on this project, and they knew that there had to be some tangible data that we could use as audiologists to say, hey, this person needs to be sent for a cochlear implant evaluation. So what they found from their research is that patients who have a pure tone average, which is their kind of 500 hertz and 1000 hertz and 2000 hertz hearing test, if that is 60 decibels or worse, and then if they score 60% or worse on their unaided, so no hearing aids, unaided word recognition testing, those patients should be sent for a cochlear implant evaluation. And her research really supported that, there was like a 96% detection rate, meaning if you applied that 60/60 rule to your patients, the vast majority of them are actually going to end up being cochlear implant candidates if they're evaluated properly and tested at a cochlear implant center. Now, that's for English-speaking adults, and I do want to mention that because something that is hopefully coming out pretty soon from our clinic is looking at our very large Spanish-speaking population down here, which, as we all know, is a rapidly growing language in the U.S. The 60% part doesn't hold for Spanish, but the 60 pure tone average, that just your hearing test, the pure tone average, it does hold for the Spanish speaking patients. So I think there's a lot of good that's coming out in the research even now to try to identify as many of these patients that we work with as possible and put them in the right hands of somebody who can help them with their hearing loss.
Yeah, that's really great information. And thanks for talking about the 60/60 criteria. I think that's really important for providers across the globe to know about, really.
Definitely.
You also mentioned something else that I wanted to ask you about, and that is this concept of the continuum of care and the fact that cochlear implants are kind of thought of as a last resort. Can you speak a little bit more about what you mean by the continuum of care and maybe how cochlear implants shouldn't be thought of as a last resort?
So when you think about a continuum of care in the medical field, anytime you're diagnosed with something, and hearing loss is what we're talking about today, typically you look at the longevity of that diagnosis and what is available throughout the patient's experience or lifetime with the diagnosis. And, so thinking about hearing aids and cochlear implants, now because the candidacy has rapidly changed and we're implanting people with better hearing, we can actually combine hearing aids and cochlear implants into one device. And so they're not even separate for some patients, which is amazing. Also thinking about patients who use a hearing aid on one side and a cochlear implant on the other, which is would work for about 80% of the patients that we see in our clinics here in the cochlear implant centers. Those patients are able to make use of both of those technologies on each ear. But having the ability to use both of those technologies on one ear is something that came out in about 2014, and it's really been a game changer for those patients with better hearing loss. And so with that being said, it's not necessarily one or the other anymore. It really is a combination, and it's looking at what devices are most appropriate for this patient, not necessarily this device, and then when they fail at that device, they go to the next device. It really is a combined effort, which is great. And the hearing aid companies and the cochlear implant companies have recognized that and have really given us as providers a lot of tools and resources to accommodate all of the patients that we can see with hearing loss.
Yeah, no, that's great. We have hybrid devices,
Yeah.
bimodal fittings on one end of the spectrum. On the other end of the spectrum, we have over-the-counter hearables, other kinds of assistant devices, even apps that can help people communicate more effectively. So a lot to kind of wrap your head around if you're a provider these days.
It is, but you can see, Brian, why it can be so confusing for patients when they're looking online or at literature. I think there are so many options, which are great, but what's right for one patient may not be right for the other. So the more we can do, especially things like this kind of interview, I hope we'll be able to guide patients in the right direction.
Great. Well, as we wrap things up here, Meredith, any final thoughts, any final suggestions that you have for hearing care providers, for consumers that might be in the market for these kind of devices that we've talked about?
Yeah, so I think I'll separate those. For consumers, what I would say to consumers is treat your hearing loss before it becomes a really bad situation. Bad meaning you are limited your socialization, your quality of life is getting poor, it's impacting your mental health, your communication with your family. Treat the hearing loss as soon as you can. There's so many great benefits, and we've seen from really huge reputable journals that treating hearing loss early can actually mitigate some of the cognitive problems that come about as we age and get into the elderly stages of life. Ask questions of the providers that you're working with, seek answers, and don't take no for an answer. If you feel like you need a cochlear implant evaluation, go get the cochlear implant evaluation. You don't need a referral. You can go find your center and we'll see you. For the providers, what I would say is, we need to do a really good job of sharing all of these patients. Only about, less than 20% of patients who need hearing aids or cochlear implants actually have them. We have a large population of patients who need to be served with technology. And so we need to work together as a team and make sure that we are offering all of these hearing healthcare continuum devices as an option when we work with our patients. And, if you guys have information or need information about cochlear implants, please reach out to any of us. You can reach out to me personally, and I'm happy to assist with connecting you with somebody in your area.
Well, that's just super advice, and we'll make sure that those links are in the show notes here.
Awesome.
As people watch this, they'll be able to access it. Dr. Meredith Holcomb, audiologist, associate professor of clinical otolaryngology, and the director of the Hearing Implant Program at the University of Miami Ear Institute. Thank you so much for taking time out of your busy schedule to spend some time with us today.
Thank you, Brian, and thank you to the listeners.